Rakhi, Peak Dcruz, and her topic is Mindset Mystery Delivering Bad News, Staying Calm Through Surgical Complication.
So, very good morning, everyone. So, I'll be talking on a mindset mastery for delivering bad news and staying calm through complication. This topic may be not very relevant to senior surgeons over here, but I think still I have seen some senior surgeons at my hospital itself who was a retired officer from district hospital. But the way she was delivering bad news, from that I understood that there is something to learn because she drops it like a bomb, blaming everything on the patient's eye. And then when the next post-op visits itself, she'll start ignoring that patient and she'll start putting that patient for the junior doctors. So there is something to learn in how to deal with these patients. Maybe in government sector, we will not get so many allegations or problems with the law and suit. But in private practice, it's always there. So it's always best to learn how to deliver this bad news and how to deal with these complications. So practicing ophthalmology is always exhilarating and fulfilling when you're able to help the patients recover their vision. But there will be times in everyone's life when we need to tell the patient that there is some negative information about their prognosis or something that has happened during their surgery. So are we really prepared to be the bearer of this bad news? Common complications that we face is PC rent, endophthalmitis, nucleus drop, no visual improvement. Then you found in the post-op that you have missed a retinal pathology. So the best thing is the need for a good preoperative chair time. Good preoperative counseling can save a lot of issues. We can detail about all the possible complications, giving example, 10 in 100, this can happen. 2%, this can happen. But the best thing is, after counseling, reassure them by just explaining that this is just a common set of complications that we say to everybody as a common protocol. It may not happen to you, but as your doctor, I will guarantee that I can give you the utmost care so that they will be also at little ease. So once the complication has happened, how to break the bad news? First, you need to prepare yourself. For that, you need to know the patient's background, their support system, that who is going to really take care of them, their financial system, their educational background, their level of understanding. And when you're delivering the bad news, be confident. Maintain eye contact, no nervous gestures, no stammering, even if you are guilty. Be assertive while talking. So there are certain protocols that are being set forward by the doctors itself. This one is called the SPIKES protocol, which was developed by the doctors in the oncological field. So SPIKES stands for Setting, Perception, Invitation, Knowledge, Emotion, and Strategy. Setting means you consider a comfortable time and a private warm space to set the meeting with the patient along with the bystanders. It is necessary not to rush the news like dropping a bomb. Take a moment first to connect with the patient and the bystanders. Whether we understand it or not, this may be complications may be common for us, but this, what we are going to say, is going to change that patient's life. Second is perception. Perception refers to the patient's current level of knowledge. You start from there. Assess whether the patient already knows or suspects that he had a complication from the conversations that had already happened in your operation theater. Invitation. Invitation is asking if the patient actually wants to hear the detail about that complication. If he doesn't, don't stress. If he wants, then also explain very lightly, don't over-explain. Knowledge. You need to share the news clearly and compassionately. You should not be vague. You should not blame everything on the patient's side. Some people say, आपका आंख इतना खराब था, मैं बहुत मुश्किल से ऑपरेशन किया है, फिर भी कुछ नहीं हुआ. Don't tell like that. Try to say in a way that's not all their fault. You can do something for them later also. So it's important to be clear and direct and remain considerate and empathetic. Avoid using vague language as it can create confusions. Try to acknowledge the emotions of the patient. Create a space for the patient to react. They might react. They will express their emotions. Put yourself in their shoes by identifying their reaction. It can be sadness, angry, shock, denial, and help them also in identifying what they are doing. Later, put a strategy. Discuss the next steps and care plans. After delivering the bad news, offer the support that you can help give them to ease their tension. This will show that you care and is willing to help. You should come up with a proper follow-up plan, outline a clear plan on how to follow up, and what are the additional financial needs that will be needed, what are the additional surgeries that is going to be there, and what all you can provide and what all you can help. Similarly, there is another protocol called the breaks protocol. This is being used in the UK, almost similar. Just three things differ. Exploring means exploring from what the patient already know about the complications. Announcing means announcing with the emotions. And kindling means finally understanding how much the patient has finally understood from what you have explained. Now to the second part, how to stay calm when you go through a complication. This is particularly relevant to younger surgeons. Complications are inevitable. Everybody has complications. We evolve and learn through our mistakes and complications. So, once a complication has happened, accept the complication. Stop denying. Even I also had this thing. There is a PC rent. I feel like, yeah, I think there is a PC rent. But my mind start denial saying, nahi, daldo lens. But stop that denial. Make sure, put tricoat, stain, and see what is really happening. Stop denying, accept the complication. Be mindful of this situation. Stay calm, take 1 or 2 deep breaths, and say this to yourself. Yes, I made a complication. Everyone does. It happens even in the hands of big surgeons also. But I am going to handle it in the best possible way I can. Concentrate, compose, stop being anxious. There is nothing you can do by being anxious. Give yourself a minute or two. Think of a recovery plan so that you can minimize further mistakes and further iatrogenic complications. And never abandon these patients. Be empathetic to them. Do the rightful things to get maximum benefit to that patient. Be considerate in all of their follow-ups. Get help from your colleagues if it is an IOL drop or a nucleus drop. Get help from your VIA colleagues and do the best for that patient. So to stay calm, finally, you have to practice certain self-regulation techniques, which include breathing techniques, practicing mindfulness, practicing grounding exercise, and control your emotions. So mindfulness is a very simple technique where you just give a 5 minutes or 10 minutes before your surgeries. You just sit in a calm, comfortable space, take deep breaths, and exhale through your mouth 5 to 10 times before you go to your surgery, especially for the junior surgeons. Do this before you start your surgeries in your earlier part of your career. This helps to ease the tension and actually avoids a lot of inadvertent tension-related complications. So finally, there is something called as a spider web of complications which happens with the younger surgeons. One complication, again another complication in the same OT, or it keep on happening in the upcoming OTs. So for this, you have to compose yourself. You have to move on. Understand that this complication has happened. Stop thinking about what has gone wrong. Remember, you can't change anything by blaming yourself or feeling guilty. So you need to refocus, give your 100% concentration on your next case, get your mind back in the game, complete that OT list. After the OT, you try to find out what went wrong. Discuss with supporting colleagues or with your seniors what you did wrong, what you could have done better. Thank you.